So chances are if you're watching this video, you are experiencing a really large eye floater in your vision. It's usually drifting from side to side, it can get in the way of seeing things, it can be really annoying, and it can even be scary if it's something new for you. In eye care, we call that a posterior vitreous detachment. And in this video, I'm going to break down posterior vitreous detachment symptoms and then ultimately different treatments for what's going on. That's today's video. Let's take a look. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about your eyes and your vision. If you're new here to the channel and you like seeing your best and taking care of your eyes, then consider hitting that subscribe button down below and turning on the bell so that you don't miss any of my future videos. Now again, today we're talking about large eye floaters, which we call a posterior vitreous detachment. Now there's a lot of different types of little normal eye floaters out there, but this is a really large floater and it gets in the way of your view, and if it's something that you're just newly experiencing, it can be associated with other symptoms that can be kind of frightening. So let's go over to the whiteboard and we'll break down exactly what's going on inside the eye. Alright, so here's a drawing of the eye just so that we understand what's going on inside when we have these large floaters. The front surface of the eye is called the cornea. That's the front window to the eye. Behind that you have the iris, which makes the color of your eye, your brown eyes, your green eyes, your blue eyes. Behind that you have the crystalline lens, which as we age, this crystalline lens starts to crystallize, eventually starts to form a yellow color, and then ultimately it becomes cloudy, and we call that a cataract. Then behind the eye, in the far back, you have this orange membrane here, which is called the retina, basically the large satellite in the back of the eye that helps pick up light information, and that light information gets then sent down the optic nerve to the back of your brain, and that's what helps you see. Now here in the middle of the eye, it's blank, but in reality the eye is filled with a fluid called the vitreous humor. About 99% of this vitreous humor is water, but about 1% of this vitreous humor is made of type 2 collagen. And that makes the fluid more of a gel-like substance, so that helps hold the shape of the eye. Now, as we age, this gel substance starts to break down, and it starts to form these little clumps, these small little specks and small little hair strands that most people, even at a younger age, can sometimes see these little specks drift back and forth. They're usually not too bothersome, but they can be a little annoying. You may notice them more if you're out looking at a blue sky, maybe you're looking at a blanket of snow, or staring at your computer screen. You may see these small little typical eye floaters more often. Now, seeing these tiny little floaters is different from having a really large floater. And usually we call those large floaters a posterior vitreous detachment, or a PVD for short in the eye clinic. Now, posterior vitreous detachment symptoms usually include a sudden large floater in the center of your vision. It can oftentimes come with flashes of light off to the sides of your vision. It can cause blurred vision, and for some people even start seeing this dark kind of cloud or curtain come in from the side of their vision, sometimes from the ceiling or coming up from the floor, and that can be a little bit more concerning, and let's go over why. Now again, as we age, this gel inside the eye starts to become less of a gel and more of a liquid. But this gel sits inside of a bag called the vitreous cortex, which is a little bit more dense gel material. And it's physically attached to the retina in the back of the eye. I drew the vitreous cortex here a little bit separated just so that you can see it better, but it is in contact with the retina and it's almost stuck together like it would have Velcro stuck together. Now, what happens again is that as we age, there's some breaks in this vitreous cortex that occur, and the liquid ends up seeping behind these little breaks and behind the vitreous cortex. And that fluid ends up causing the Velcro between the gel and the retina to start separating and peeling apart. So you have this bag that starts to pull away from the retina itself. And that's the beginnings of a posterior vitreous detachment. So this empty space here is now filling with the same fluid that was once inside of the general gel bag. Now, what happens more so when you start developing that large floater in your vision? Because right now you may not even notice any sort of visual symptoms changing with just this small vitreous detachment that's going on right now. But when the gel fully gets down to the optic nerve here, the gel is more firmly attached to the optic nerve. There's more gel substance around it. So when that plugs off, it can usually plug off pretty tough. And then you start to see this really large, almost crescent moon or large circle inside of the back of the eye. And your eye doctor will notice that, and I'll throw up a picture here of what that looks like. Your eye doctor will look inside and they'll see this nice round circle, and we call that a Weiss ring. In fact, we call it a Weiss ring because the gel material that is forming that ring looks kind of white when we look inside the eye. And that large bundle of material that's floating around inside the eye there, that's your large floater. And yes, funny enough, there are people who name their large floaters. Certainly let me know if you guys have a name for your large floater that occasionally comes into your field of view and you're just like, oh yeah, there's Carl or something like that. Let me know what name you have for your eye floater if you've named it. Now, the other thing that's really important outside of just recognizing what this large floater is what the other symptoms that you could be having, those flashes of light, or if your vision's starting to get blurry, or heaven forbid, you're starting to see that dark cloud coming in from the side. Those are usually hinting at something a little bit more sinister that could be going on inside the eye. Now, when this gel peels away from the back of the eye, it occasionally is really densely stuck to parts of the retina. And when it's tugging, when it's starting to peel away, it'll have some traction and it'll tug on the retina. And your brain doesn't know what to do with that, doesn't know what kind of sense. It's not like a normal visual signal. So your brain sees it as just a flash of light. So that's what's going on when you see those flashes off to your side. Now, usually when this peels away, nothing happens. You see the flash of light and it's done. However, for about 5% of people that are having this, you can also create a retinal hole, a tear, or a retinal detachment in the back of the eye. And that's a lot more serious. Now, usually when you're starting to have those symptoms, if something is changing with the retina, such as a retinal hole, a tear, or something like a retinal detachment, you may start to have visual symptoms, such as not just little floaters, this large floater, but you could have blurred vision, and then ultimately that dark curtain could mean that the retina itself is also detaching, meaning the fluid is now getting behind the retina, and the retina is starting to lift off from the back of the eye. If you are just experiencing new symptoms, this large floater, blurred vision, any flashes of light, it's important that you maybe stop this video and call your eye doctor and get scheduled to be seen, because catching those sort of symptoms early on and catching that if it is a tear or detachment early, it's better treated and has better results if it's caught early on. So again, don't hesitate. We see this all the time. Give your eye doctor a call and get seen. Now let's just say this is a recent change for you. You go in, you see your eye doctor, and they say, yes, you have this large Weiss ring, you have a posterior vitreous detachment. They will probably tell you the exact same thing we just went over in this video. However, they'll usually have you back in about 4 to 6 weeks. It's fairly standard practice in eye care, whether it be optometry or ophthalmology. They'll have you back to dilate your pupil. They'll look inside once again. And they'll do that about 4 to 6 weeks later, because studies have reported around a 2 to 5% risk of still finding a hole, a tear, or detachment at about a month later. In addition, sometimes this gel peeling away from the back of the eye can cause other little problems, and your doctor may want to further evaluate the retina for small little micro wrinkles or changes that could be causing problems with your vision. I know at our clinic one time, a patient missed their follow-up appointment at 1 month, and then they ended up calling 2 days later because they all of a sudden started having vision loss. And yes, they ended up having a small tear in the far edge of their eye, and it was leading toward a retinal detachment. But thankfully, everything was caught, they had surgery, and things went well. And if you want to learn a little bit more about retinal detachments, I do have a video going over retinal detachments and the different treatment options for those, and you can check that out by clicking or tapping the screen up here to the side. Or if you want to learn a little bit more, you can check that out in the video description below as well. Now, as far as treatment for this large eye floater, this posterior vitreous detachment, this Weiss ring, I want to go over that next. But first, again, let me know in the comment section how you're liking this video so far. If you have any other further questions about how this posterior vitreous detachment develops, I'd love to get back to you. So again, drop those comments in the section below. But as far as treatments for this posterior vitreous detachment, right now in eye care, there's generally 3 different treatments. The first one is we just watch. Most people who come into the clinic that see me for this condition, we tell them, hey, this is what's going on. We'll see you back in 4 to 6 weeks. At that point, most people even say that they don't see them as often. Sometimes just due to gravity, this large floater will drift out of your field of view. and you won't see it as much, or your brain neuroadapts to this presence of this large floater, and again, you just don't see it as often. However, for those other few cases, I know some people out there are really bothered by these floaters. It's constantly drifting in the field of their view. They can't see to drive, they can't read, they can't function, they maybe can't even work. So because of that, then there are some treatment options where we can help remove these floaters. Right now in standard practice in ophthalmology, there are the two treatments. One is using a laser called laser vitreolysis. And that's where they use a YAG laser to zap through the front part of the eye, and they go all the way to, and they vaporize parts of this large floater. And that helps dissipate it into lots of small little pieces to the point where you don't see them as often. In general, there's different people who are good candidates for that procedure and people who are not. If you want to learn more about that procedure, again, I have done a video all about that specific topic. And again, I'll hook that up here in the YouTube card or again in the description below. But the other option, if you're somebody who you're like, no, I can't stand even the small little floaters that you've been seeing for a long time, they're driving you nuts, then there is another procedure. And that one's called a vitrectomy. And that's where you have to go into the operating room. You meet with your surgeon, they're going to schedule you a day for the operating room, you're going to go into that operating room and they're going to physically drain all of the fluid inside the eye and they're going to replace it with another fluid. Now because you're going into the operating room, it's a little bit higher risk for complications such as developing cataracts, as well as other complications of the eye, potential infections, things like that. And a lot of surgeons for eye care will typically not recommend it unless your vision is significantly impacted. So again, if you're somebody who just doesn't feel safe to drive, you can't function, you can't work because of these large floaters, they'll be more understanding and more willing to go ahead with that procedure. But usually if you're still seeing 20/20 and you're just having these floaters, your doctor will probably advise against having that surgery. Now the final thing I want to comment on is that a lot of people reach out to me asking about, hey, are there any sort of at-home treatments or eye floaters homeopathy that can help? Unfortunately at this time in Western medicine, there is very little evidence to support that any sort of eye drops or a diet change or anything like that is going to improve floaters naturally on their own. Usually just letting them go, they'll drift out of their field of view or your brain will neuroadapt. All other treatments that you'll see online that people are advertising or trying to sell you are nothing that has been at least found or been published or studied on in ophthalmology. And that's why most eye doctors, pretty much any eye doctor I've ever met, they never recommend these things. So if you are considering getting MSM eye drops or getting some honey oil to put in your eye, chances are it's probably not going to work and you may be even jeopardizing the health of your eye. Because again, a lot of these different treatments are not well studied. And right now, the current status or current position of both the Academy of Optometry and the Academy of Ophthalmology is that there's just no evidence to support their use. And if you are using anything like that or you're trying it, I highly recommend that you do consult with your local eye care professional so they can at least make sure and follow up with you that your eyes aren't having damage or any sort of problems because you're using these different drops. However, with all of these final comments being said, I know that there are different pilot studies in terms of different treatments and things that are being researched right now, so I'm hoping someday we will have a better treatment for these eye floaters, whether that be with an eye drop or something like a medication that you can take orally. Yeah, I'm really hopeful. Otherwise, thanks for watching, and if you enjoyed this video, smash that like button for me and share this video with any friends or family that you know might be having these sort of symptoms. If you'd like to learn a little bit more about eye floaters or the treatments for eye floaters, I do have a full series. You can click or tap the screen up here to the side if you want to check that out. Or if you want to learn a little bit more about different eye care topics, go ahead and click or tap the screen down over here. Again, this is Dr. Joseph Allen here from Dr. Eye Health. Keep an eye on it, and we'll talk to you soon.